So my project is fibromyalgia and the role of massage therapy. I chose this problem because I've suffered with fibromyalgia for almost about 20 years now. I would say at least 15. And fibromyalgia has thrown my life down spiral whenever I did not understand it, and I did not understand the ways I could in my own life take to be able to maintain and self-regulate. The fibromyalgia really affected me to where I could not get out of bed. I had trouble concentrating. I was in chronic pain all the time, and the doctors just wanted to put me on pain pills and antidepressants and anxiety medication. That made me lose myself and I felt like I was losing my identity, and I felt like I was just kind of like a zombie. Whenever I was in that state, I did not feel like I could accomplish any of my dreams or goals. And then I discovered ways to be able to self-regulate through things like massage therapy and diet and exercise and other stress reduction techniques. Once I entered the massage therapy program, I got to learn a lot more, and I discovered that massage therapy, which I thought was a muscular disease, is actually a nervous system disease. It is actually defined as a multifactorial condition affecting the hormones, the neurotransmitters, sleep disorders, chronic pain that is felt in the soft tissues, especially the muscles, tendons, and ligaments. Fibromyalgia is something that creates tender points all over your body, and it's very, very hard to diagnose because it mimics so many other diseases. Some people go their entire life without having a proper diagnosis. Some people, it can take sometimes even 10, 15, 20 years for a proper diagnosis, which if you're going to multiple different doctors trying to figure this out itself can be very exhausting. But how they do diagnose fibromyalgia is looking for 18 different tender points. Now, tender points and trigger points are different. Tender points is when you have an area on your body that's just tender to the touch, no matter what. It can lessen sometimes and it can get more extreme sometimes, but it's almost always there. I found with my own personal experience, massage therapy helps make them less tender and to where you can actually have a little bit of pressure applied without it being just exhausting to be touched. Massage therapy in my own personal life has been able to help me maintain and be able to continue on with my day-to-day activities, as well as the other types of things like proper exercise. There are different types of techniques like deep breathing, meditation, yoga, mindfulness meditation. Anytime that you can really take yourself out of being distracted by what everything's going on and connect with your body, which is what massage therapy does. It helps you, especially Swedish massage, connect with your own being. The appropriate massage therapy that is recommended for fibromyalgia is Swedish massage, but that is not always what the client needs. It's so important to sit down and talk to your client and really have a one-on-one conversation at the beginning of each session to make sure that that is what they need for that day. If the client does want some deeper pressure, you need to talk to them throughout the entire experience and let them know, okay, I'm going to go a little deeper. Is this okay? And then just keep asking them, because it is very tender, but sometimes that deeper pressure for certain people is what they desire at that moment. It changes though session to session. Massage therapy can help improve the quality of sleep, reduce anxiety, depression, improve the overall quality of life and health status. It works great with other types of integrative therapies like massage or yoga or deep breathing. It is also really great to help people come off of certain medications. Not that it is a replacement for the medication, but certain painkillers and analgesics, it can reduce the amount that the person has to take over time. Massage therapy is a wonderful tool for fibromyalgia. It is something that can help bring about a lot of ease into somebody's life. Now, there are a lot of people that face fibromyalgia in America, and it is kind of one of those silent diseases, but in America alone, over 12 million people suffer from this, and a lot of them never even express it. A lot of people stay in the silent and a lot of people just don't understand what they have to go through, because sometimes you cannot get out of bed. No matter what you want to do that day, no matter how many priorities you have, you feel so immensely in chronic pain that you cannot get out of bed. Your entire body aches, you have trouble sleeping, you have trouble digesting food. Some people even have trouble with like TMJ, they get headaches more chronically. People with lupus and rheumatoid arthritis also have a higher chance of developing fibromyalgia, as well as people with insulin issues. It is really important that for all fibromyalgia patients that they seek a medical profession that understands what they're going through, because there's a stigma where it used to be that people with fibromyalgia would go to doctors and the doctors would tell them it was in their head. Now, could you imagine being in chronic pain, not being able to get out of your bed, not being able to go to work and keep a job or go to school, and being told it's all in your head? Now we're coming to a place where we're doing more and more research on fibromyalgia. There's a lot more being understood, and there are doctors that have been trained properly to be able to deal with this. Rheumatologist is the doctor that you would see for fibromyalgia, and they would do the proper diagnostics, where, if I can show you this, it is these 18 trigger points. And now, to be able to be diagnosed, you have to have at least 18 trigger points. I think there are like 27 altogether, but at least 18 of them have to be identified.